All right, we are recording now.
It's 2:30. I'd like to call the meeting of the Legislative Committee, Dunn County Board of Supervisors on Wednesday, October 9th, 2024, at 2:30 PM in room 54 of the Dunn County Government Center. The first order of business, we call it to order, which we just did. Call of the roll. Everybody's here except Supervisor Vogel, who will be excused today. The next order of business is I see County Clerk Marcel lurking over there. What's going on?
I have a public comment I was going to read.
I'm not there
I
yet.
know, I'm prepared for you
right,
whenever
here
you're
we
ready,
go.
Mr. Chair.
Next order of business is the approval of the minutes for May 8th, 2024 meeting. What is the board's desire? There's Supervisor Morehouse moves and Supervisor McCulloch seconds. Any discussion, corrections? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carried. Approved. Item number 4, as we're waiting with bated breath for Mr. Marcel, public comments.
There's one public comment submitted on Thursday, October 3rd at 4:07 PM. Public comment to the Legislative Committee of Dunn County. I hope that the Dunn County will continue to support my quest against the unfair taxation relating to the antiquated funding statutes of the Wisconsin Technical College system of this state. Experiencing a 40-year high in inflation seems not to affect the continued borrowing of TCS, Technical College System, in the state. I will attach an email of the borrowing that Chippewa Valley Technical College has scheduled. When one combines the unfair taxation of the TCS and the flood of school district referendas coming in November, over 130 plus school district referenda, my demographic, retired seniors living on a fixed income, and others have to make hard choices. Forward Analytics from the WCA, Wisconsin County Association, recently came out with a report entitled, quote, K through 12 on the ballot, end quote. Dale Knapp's presentation at the recent WCA conference in La Crosse was also an eye-opener relating to the other issues Wisconsin will face in the near future. I will end my comments by asking a question. Elected officials take an oath of office in many instances, usually supporting the U.S. Constitution and Wisconsin's Constitution. There is nothing in Wisconsin's Constitution or statutes that state public higher education is mandatory. None. Best regards, Terry Nichols, Town of Colfax.
Thank you, Andrew, and thank you, Terry, for your letter. He's a crusader, and he's well known at the WCA and also in Madison because he's pretty well researched on what he does. Next order of business is the consideration of reports, resolution, and ordinances to the county board from the legislative committee. 5A, resolution adopting the 2024-2025 legislative agenda. You all should have received a copy of that in your packet, and I hope you've had a chance to review it. I would entertain a motion to approve.
I would. That's right. I would move to approve as presented.
I will second.
We have a motion by Supervisor McCullough and a second by Supervisor Morehouse to approve the legislative agenda as presented. Are there any questions, corrections? Supervisor Kinnear.
I wanted to note in the nursing homes, 4A, it seems that the last sentence of A isn't a sentence or it's confusing. It could easily be fixed. It's just grammatical. And I suggest that, yeah, okay. I would suggest that we listen to Chris Corpola on that.
All right, we have a suggestion. Where is that at? 4A?
4A, the last sentence, take out the word assist.
All right. Any other corrections or suggestions, Supervisor Headland?
Yeah, just a question. In the war for the resolution for community support programs, whereas more programs CSP offer intensive.
Oh. That'll be a separate item on our agenda.
Oh, okay.
Yeah.
Okay, I'm sorry. I went down too many pages.
Due diligent is always a good thing.
Yeah,
That's okay. We still like you.
yeah.
Okay. Any other corrections or anything?
I would just ask maybe for some feedback on the number 5 financial section. That section just has come forward kind of from year to year. And given the change in shared revenue last year, do you want to make any changes to that? Much of it has to do with levy limits and corrections to that. So as well as the technical college piece, I don't know if there needs to be changes to that section.
If I may, county manager. WCA has worked very hard on getting us a piece of the sales tax, and there has been no appetite for any discussion of the levy, one way or the other. So it might be a point well taken, because I think they're gonna concentrate on trying to increase the percentages of the sales tax. So, what's the board's pleasure? I guess, what would you like to do?
So Supervisor, Steen, if I may,
Yes.
what, are you
Supervisor.
suggesting that these items be removed or what?
Well, I guess my conversation with Kyle Christensen, our main lobbyist, is that there's no appetite for any discussion on the levy limits or that type of thing. So I would defer to whatever the board thinks, if we're beating a dead horse, or if you think it's okay to keep it on their radar. I guess, does that make sense?
I think it's probably not unreasonable to keep it on the radar. It's as much work as we put into this, and as fond of as I am of it, I don't think that a line item suggesting that we would like to see the levy adjusted, which I think we would, is gonna cause any real problems.
Thank you, Supervisor McCullough. Any other?
I also think if I may, Mr. Chairman, I mean, few of these items are ever acted on. Most of them have been on the legislative agenda for a very long time. I know the Health and Human Service items have been there forever. And I don't see any reason to remove it. It just makes sense to me.
As I survey the crowd here, my sense is that we would leave it as presented, except for the striking of the word assist in 4A. Would that be reasonable? Then we have a motion and a second, I believe, correct? All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion's carried. Thank you. Now we got to get into where I should be here, Vaughn, huh? Resolution supporting the expansion of Medicaid. And speaking to this, I'd like to have Supervisor Morehouse, who's the president or the chairman of the Human Services Committee, speak to this, if she would.
Yes, thank you, Mr. Chairman.
Do you, excuse me, do you wish to take a motion first?
As I am rightly corrected, I would entertain a motion.
So moved, Mr. Chairman.
We, Supervisor Morehouse moves, Supervisor Kinnear seconds. And now, just to make everybody happy, we'll have a discussion.
Okay, you know that this item, speaking of items that remain on our overall legislative agenda, this has been on our legislative agenda as county for at least 4 years and perhaps longer. So what the Health and Human Services Board, with a lot of research and information from one of our citizen members, Dr. Alexandra Hall, about the impacts of this, accepting the federal Medicaid expansion in Wisconsin, would do in Dunn County. I'm going to share some numbers with you if you don't mind. Wisconsin is one of only 10 states that has continued to refuse the expansion of federal Medicaid. And what that practically means is that families get caught in this kind of, they call it a coverage gap, which means that they make too much money to qualify for Medicaid, but they don't make enough money to qualify for They make too much money. They make too much money to qualify for Medicaid, but they don't make enough to qualify for the Affordable Care Act marketplace. So they're caught in this cash kind of crisis, which means that people forego medical care, postpone medical care, all of which have enormous individual costs and some pretty significant, I think, societal costs. So what this would do is allow people up to 138% of federal poverty to qualify for Medicaid. That here in Wisconsin, that raises the income limit from $26,500 to $36,570. So in Dunn County, 21% of our households make less than $30,000. So we think the data indicate that at least 1,000 individuals, in addition to the the number of households, would qualify for this, would benefit from this expansion. So what that means, obviously, for individual health is fairly significant. In states where the Medicaid expansion has been improved, there are reduced rates of cancer, there are reduced rates of infant and maternal mortality. There's vastly increased use of preventive services. And in fact, there is a reduction in deaths from opioid overdose and from cancer. So on an individual level, it's pretty significant. On a kind of community level, it helps workforce. If people are healthy, they work more. If people are healthy, they're more willing to take extra shifts. It begins to address some of the workforce shortage kinds of issues that we have. And from a systems perspective, as we've all learned from the closure of HHS Prevea, research indicates that in rural areas, in rural states that have approved the Medicaid expansion, that rural hospitals are 60% less likely to close. It improves their operating margins significantly, almost doubling their operating margins from 2.1 to 3.9. The reason, one of the reasons, not the only reason, but one of the reasons that small nonprofit hospitals are losing money is the amount of uncompensated care that they provide. They can't turn people down. So with a Medicaid expansion, with it accepting the Medicaid expansion, there would be many more people who are able to pay for services, and hence the less likelihood of enormous amounts of uncompensated care for rural hospitals. I've asked the county manager to put Dr. Hall's pretty lengthy research packet in the packet for the board meeting this month. And I would be happy to provide it to you too. We just didn't share it in the packet because it's a little, it's detailed and long, but it was excellently well done. And that's it, and I'm happy to answer any questions. This passed with only one dissent in Health and Human Services, and it's been discussed a number of times.
If I might,
Yes, Supervisor McCullough.
a bit over 1,000, so,
1,000 people.
right, which is between 2 and 3% of the total population of the county.
That's correct. That's correct.
Well, thank you for that dissertation off the hip. Evidently, she's done her homework, and Supervisor Hall did a terrific job. And just as a point of information, I took the report down to the WCA, gave it to Kyle Christensen, the lobbyist for the WCA, and also to Dale Knapp, who runs Forward Analytics. And I made the comment that, I don't know if you've done this before, but perhaps going forward, the counties would be well served to break it down and put some real numbers in there, county by county, when they go to a lobby. And then also Kyle made the comment that he thought the Association of School Boards would like that, will utilize that information that I gave him. So I'm happy to do that. Thank you very much. Any other discussion, comments? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Next order of business is 5C, resolution supporting increased state funding for medical assistance and community support programs. Is there a motion?
So moved.
Supervisor McCullough moves, Supervisor Bauer seconds. Is there any discussion? Ms. Supervisor Headland?
I'll get in the right pew here yet.
Yeah, that's all right.
Sorry about that. Just a question on, under the community support programs, offered intensive community-based care for adults with mental illness and functional limitations, require them to need otherwise requiring them to need institutional care. And counties then use the services to keep people out of extended hospitalizations and support people in the community following that. That in Boyceville has been a failure. I don't know how else to say it. I've talked to Chris about a neighbor that I had and trying to get help from the county and services and so forth. And, you know, the type of help that was offered, the diligence to make sure that it was done timely and followed through on was not. Just to find out that social worker, I guess, quit. And then another one took their place, but had not been given or passed on the information even about this particular individual. Another individual prior to that, we found him dead in the sidewalk in Boyceville. That was a case that I heard about presented by the health department at their report. And they did finally get to the point of extending some even health services, but it just was too late. The police chief up there, along with county officers, have, you know, been trying to contact department. I tried to contact them. Finally, one day I said, well, isn't there somebody sitting over there in the chair? You're going to switch the call over there to me. Yes, there is. I said, good. And twice they never picked up the phone. And I called again, and there's actually somebody sitting over there. Yeah. Well, I said, why don't they pick up the phone? I'll transfer the call. Nobody picked up the phone. So I didn't want to bring it up at the meeting. Neither the report, it wasn't the place to do it. But I guess this is a place where we have our committee chair and probably one of the most experienced healthcare people in the state. And I don't know if it's an issue with staff, losing staff and transitioning staff. You know, I don't want to blame any department if it's one or two individuals. But it's really worth looking into when people are, we finally got, ended up in a hospital up in the Twin Cities. He's been there now for a number of weeks. He went from 138 pounds. He's getting back up to the 195, man, 6'2". He just, you know, we met with the people over there. His sister did, and they would ask him questions, and she said, those answers aren't, he doesn't know what he's saying. Oh, but he knew that he knows where he lives, and he knows he had breakfast this morning. Well, he didn't know he had breakfast this morning. He said he just had food. When asked what he ate, he didn't know, he just had food. So those, to me, aren't the kinds of answers that a social worker should be getting and saying that this man's fine and safe in his home. He broke all windows in his home. He walked up and down the middle of the streets. We found him miles from town, up on County Double F, walking down the middle of Delaware up at 4:30 in the morning. I don't know. I like the idea of it, but I don't think that we're getting the services that program is designed to give. And I don't want to see it end up some point where somebody's relatives file a lawsuit against this county for wrongful death because they didn't get the treatment they were supposed to get. The taxpayers are paying for.
So I see Paula pop up. If you'd like her to comment.
There she is. I was going to suggest that.
Thank you for letting me participate virtually. My back went out, and so I'm at home today instead of at work. So, what I think I'm hearing, although I'm not real sure because I'm not familiar with names and being a public meeting, I would not want to share names either. But what I think I'm hearing is adult protection services potentially for people that may need a guardian or to be protectively placed potentially. So I don't have the whole background of things, but that is a very different program than the community support program and crisis program. So we do have community support and crisis programs that are part of the Department for Behavioral Health, and those are programs where individuals reach out and want to receive services for chronic or persistent mental health, or they are being referred because they're suicidal or homicidal. In the crisis program, that's the case there. The criteria for the CSP program is they have severe or persistent mental health concerns. So we do have those programs, and we do, through a county, pay tax levy for a portion of those costs. And so what we're asking with this resolution is that the state pick up that portion like they do in some of the other programs to help individuals. And we do have data that would show in our reports that those individuals have less hospitalizations since we have put those programs into place. I'm not sure what happened that you were referred and telephone calls not being answered. I apologize for that. That's not how certainly I would want our department to operate or respond to people. And so I don't have the answers of what happened there. And certainly we could sit down and talk about that. And I could try to get more down into when and where and what was behind that. But really, the bottom line is we should be responding back to people. And so if that happened, I apologize to you for that. The adult protection services that I think that you may be describing may be a little bit different because we have to follow state statutes as to what meets that or not. And we could talk about that maybe offline as to what happened there or not. Sometime if we could connect outside of the meeting, but that is a different program. And certainly we want to make sure that people are receiving the help they need in that program as well. We did have several change of staff in that program, and I think that may be what you were indicating there with that. But certainly we want to make sure that we are covering where we can as well with that program. But that is a different program if I'm understanding what you're describing there. Is there other questions that
Well,
you
Paula,
had?
this is Gary Steen, and thank you for your answer. But what I'm suggesting is that you and Vaughn get together and you dig deeper into this
Mhm.
and get as much information as you can, because no, we don't want to operate that way. And then just as a point of information, this was given to us by the WCA, I think. Because
Yes, that's correct.
they're trying to increase their lobbying and they're to get more money in the system so we can do a better job. So
Mhm.
although we all know somebody slips through the cracks and it's no good, especially if it's a neighbor or a relative, but
For sure, for sure.
If and that's great. I mean, that, my question is, like I say, I like the idea of the program. I mean, where we can be out there amongst our county residents and yeah, if we can keep them from not having to lose or move out of their home, that's where I'd like to be. But, I just, when when it's a friend, it's different.
no, you did your job as a friend and as a board member. That's
Yeah.
understandable. And the services that the county provides, far-reaching, touch everybody's family in one way or another, and we want to do a good job on that. And our efforts is to do that. So Paula and you will get educated on that situation. Is that all right?
Yeah, and
All right.
thank you, Paul.
Thank you
Yeah,
very much.
yeah. I'll connect with you and we can sit down and talk about it
Thank
further,
you
okay?
anytime. Appreciate it. Yes, very much.
Thank you, Paula. Good
Thank
luck with
you.
your back.
Thank you.
Any other discussion, questions? And I appreciate that, Vaughn. doesn't do any good if we know something and we don't bring it up. You know what I'm saying? Even if we don't want to bring it up, because it is what it is. And so we'd like to address that. Yes, Supervisor Morehouse.
Yes, thank you, Mr. Chairman. I just wanted to echo what Supervisor Steen suggested. This was a direct request from the Wisconsin Counties Association, and the language in the resolution, it's been tweaked a little bit, but it's largely WCA's language.
It was, yeah, it was passed as part of the annual resolutions package during the business meeting at WCA. So the vast majority of Wisconsin counties are behind this in general, and we'd like to see it propagate out for specific county adoption.
Well, thank you for the discussion and fleshing out of problems and where it's coming from. So unless there's any other comments, all those in favor signify by saying aye. Opposed, same sign. Motion carries. Thank you. Now, as we steamroll through, when's our next meeting? What do you think? County Manager Corpola, would you have unless we got some items hanging in fire here, I don't think we have anything that's in the queue, so to speak. Pardon?
Okay. Good. That was what I was gonna say. Go ahead.
Do you have any plans, or do you want to make any plans for having legislators come up and visit with the board early in the year or at some point in time?
Thank you, Nick. What's the board's opinion? What's the board's pleasure on that? We've had, over the years, we've had no success. We've had moderate success. We've had some success. Pardon?
So I think that, earlier this year, we were going to invite them to come and do kind of a social, a meet and greet ahead of time, and then actually just a very short presentation. So people got a chance to talk to them one-on-one. The difficulty we ran into was that they were in session at the time. It's a little bit hard to schedule sometimes because they don't know exactly when they'll be in session or not. But they happened to be in session, so they were not going to be available. Most of them were not going to be available at the time that we had scheduled. So we can, I'm willing to coordinate whatever we would like to do. I just would like to have a conversation about timing, because we'll have an election and then those people won't be seated until January, and then they'll go into their first session sometime in January through late February-ish, sometimes early March. So
Late March then, maybe?
If I might, I would suggest December. We'll know who's elected, talk to them before they go there and express our concerns. Does that have any merit, do you think?
Sure.
Because once they get there, the new guys are they'll be in a whirlwind trying to get themselves squared away and all that stuff. And then they'll have plenty of scheduling to do there, I'm sure. Now, I suppose we don't have to decide today, but well, maybe we should if we can decide. Why don't we give it some deep thought for 30 seconds and let me know what you think?
You already have a special meeting coming in December. Something to think about. Yeah,
Yeah, the plan for that was,
right. But it'll be another meeting, which is fine. I just want to bring it up as something you may want to account for.
I guess this is just my opinion, but I think it's worth meeting them face to face and having a chance for them to meet their constituents and you to meet them, put a face on the Dunn County Board. And I think if, as we go forward through the years, if our requests make sense and they're well thought out, it's a good opportunity to lobby and build respect with the legislators so that, you know, they know who you are and hey, they're not asking for the moon. They're just regular people trying to advance the well-being of Dunn County. That's how I would look at it. And yeah, it's another meeting, but I think it's money well spent because otherwise it's hard to get them here otherwise, to be honest about it. I don't know about December, but you know, the election will be over. We'll know who's gonna go. Maybe put a buzz in their bonnet about what's important. So it's up to the board here, whatever your wishes are.
I guess my concern about December would be attendance from the county board members who are already doing the one special meeting and who in general scatter to the winds because they don't think of December as being a meeting season. But I'm open to December, but I think probably either December or late March or early April are our options.
I was thinking like December 24th. No, I'm kidding. I'm kidding. Yeah, I'm, and, you know, I'm open to whatever you guys decide. I have ideas. Some are good, some are bad.
Mr. Chair, I
Yes,
kind of like to go with McCullough here. I think later would be better because we've had them in the past and there's hardly no shows. I mean, you get one or two, but they're pretty late,
Okay.
so.
Yeah.
I would think going later would be better. That's my opinion.
Point well taken. Thank you. Any other Supervisor Morehouse?
Yeah, I think I echo what Supervisor Bauer just said. I mean, we've had really significant problems with attendance. I think December would only exacerbate that problem. I don't have any objection to trying to organize them for a meeting. I just, December is maybe not the best.
And I think the last time that we actually physically met in person, we had a pretty good turnout. Yeah, I think we had 5 of, well, I forget because we had 8 for a while. I don't know if we had 5 of 8 or 5 of 6, but do you know how many we have now, Andrew? 6? 6, 7. Okay, so. Yep.
Okay.
So, yeah, we had pretty decent representation the last time. Again, that would be not last year, but the year before that. So 2023. No, the last year was 23, 22. Yes.
Well, any other comments?
I mean, the other thing that you could consider, which would be maybe a little less, well, I'll just say whatever it is. You could consider the concept of kind of a meet and greet, and quick present. You could do it before a county board meeting, and then that way people are here anyway. You know, do it at say 5:30, and then I'll have some light snacks, hors d'oeuvres, whatever, and then maybe presentation at 6:15 or whatever for 20 minutes. I mean, that would be an option as well. And then who comes. It's also an option to add a remote option for participation, which might get some people who, even if they were in session, they may be willing to appear remotely on an evening when they're in session, if that's an option to them.
Mr. Chairman,
Yes.
this is probably an aside, but how do they get this document? How do
I send it to them.
it just gets sent to them?
So,
from the
well,
chair?
so I coordinate with their staffers to let them know of when the meeting is and invite them and then follow up if I don't hear back from them, and then they commit or they don't commit. And then I forward this ahead of time, and then we give them it physically if they come that evening as well.
So they get some sort of, I mean, it doesn't just appear in their email.
Right.
Okay, thanks.
Might I suggest before the April meeting? Because before the March, if they may, it would not surprise me if session runs long this time with a lot of turnover. So, you know, if they're still there in mid-March, we don't want to end up having them run a late session into our window. So April will hopefully be a pretty light month for us, given where it is in the budget calendar. And
I was gonna say, so biennial budget, so we'll be in a biennial state budget next year in 25. And it will be, the bones of the budget will be known by April. So if there are items of particular interest that we wish to advocate for at that point in time, that would be an option as well.
As I said, I have a lot of ideas. Some of them are good, and I guess mine wasn't too good, but that's all right. I'm fine, if the board is fine with, the April meeting and, a kind of a meet and greet like, Chris suggested. I think that's good. We don't want to overwhelm them with too many requests, but it's good to meet them on a kind of a social level and, talk a little bit. Would that be agreeable then with the board? So if, probably, do we need a motion to that effect? Okay, well, we'll plan on the April meeting to have a meet and greet, and Chris will take care of the logistics to line that up and go from there. So being that we've completed our business at hand here, we are adjourned. Thank you for coming and appreciate it.